Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome to Physician Heal Thyself, the podcast. I'm your host, Dr. Lara. Today, I want to talk about something I often get asked this question, and that is, what sets a naturopathic doctor apart from the rest of doctors or practitioners, right? So in this episode, I want to talk about, it's not going to be a comparison necessarily. I always say it's not fair to compare a naturopathic doctor to a conventional medical doctor or a nurse practitioner, etc., in either direction, because we are in different paradigms. And so let me explain what that means, because you hear the term naturopathic medical doctor, and the assertion is that, we treat diseases, right? Which it is true, but the approach is different. So I want to talk about the philosophies and the approaches, the therapeutics that are different, and what sets us apart from functional doctors, integrative doctors. And if you're a naturopathic doctor watching this and you went to an accredited naturopathic medical school, you are not an integrative doctor and you're not a functional doctor. The philosophies that we are taught are very, very different. And so we are not the tools that we use to help people heal. But we have to understand that the philosophy and the approaches that we take, they do differ. So in conventional medicine, you come in with a symptom or symptoms, and you're going to be treated for those symptoms by given medications. And that is not the way the foundations of naturopathic medicine were never to just treat the symptoms. So in this episode, I talked in past episodes about nature cure and about naturopathic medicine and some of the different therapies that we might use, whether it's homeopathy or hydrotherapy, right? These are tools that we are trained in doing. But the foundations of nature cure, or naturopathy, are very different. Nature cure is a system, right? It's a system of building the entire being, the person, in harmony with constructive principles in nature on the physical, mental, moral, and spiritual planes. And in this episode, we're going to talk about what sets us apart from other practitioners. And in the next future episodes, I want to talk more in depth about the principles and the therapeutic order that we take. So when a naturopathic doctor approaches a person, we're asking a lot of questions, right? We are taking an in-depth evaluation of the patient. So when I'm referring to what sets us apart is not just conventional medical doctors, nurse practitioners, physician assistants, chiropractors. We share some similarities, but it's still not the same foundation. Nutritionists, like I said, functional, integrative doctors. How do we distinguish ourselves? And so a naturopathic doctor, we have a philosophy that takes a certain order, and that is that we understand that the body has this innate ability to heal itself. And people like chiropractors, that practice, they understand that, right? They understand that the body has an innate ability to heal itself. And so then we need to identify what are the things that could interfere with the ability for that person to heal. So here's one thing that I hear a lot with patients when they first come to see me. They'll say, my body is trying to kill me. That's not true. My body is attacking me. That's also not true. Why is my body doing this to me? And so we see our physical body as it's something or someone outside of us that's doing this harm to us. Instead, the question should be, what have I done to reach to this point? What are the things that I have done that have contributed for me to have these symptoms? So when you have a sign, it's a physical, a visual sign of illness, right? It could be a rash. It could be, dark circles under your eyes, hair falling out. Those are visible signs that something's going on in the body. Symptoms are how you feel. Symptoms are, if you're feeling fatigued, if you're having abdominal pain anywhere, those are symptoms. So when your body is giving you signs and symptoms, it's actually alerting you that something is out of balance. So it's information. I want you to look at these signs and symptoms as simply information that your own body, that's so intelligent, it's nudging you. It's giving you a sign that something is wrong, to give it attention. I always compare a sign and a symptom similar to the red engine light on your car. When it turns on red, that's a sign something's out of balance, something's not in harmony. We need to take it to the mechanic. And so I'm going to tell you that I find, unfortunately, people who take better care of their cars or their homes or some material object better than they take care of their bodies. And so the body's giving us signs and symptoms all the time, but we just keep pushing and pushing through. There's work, there's things to do, and you don't make yourself a priority. Now, I understand, I'm very understanding and compassionate that we also live in a world where doctors are very dismissive. They don't hear you, they don't acknowledge you, they don't do the right testing, they don't give you the right treatment. So there's this fear, there's this kind of disgust of people going to see a doctor. There's a lack of trust, of feeling safe, of feeling heard. So I get it. But there are ways to heal. And this is where I wanna set the line, in the sand, draw a line in the sand to distinguish what a true naturopathic medical doctor is versus any other form of practitioner. Now, it doesn't mean that we can't work together. Of course we can, but you're talking about blending two completely different worlds. And a medical doctor, even a functional and integrative doctor, they're using natural things to help their patients. However, the approach, the philosophy, the therapeutic order, very different way of thinking. So let's get into what we're going to talk about in this episode today. I don't mean to, hurt anyone's feelings. I just feel that as a naturopathic medical doctor, there are still so many people that don't know who we are. They don't know what we do and how we approach care. And so I do want to set ourselves apart from functional and integrative doctors because the philosophy and the theories that we understand, that we've been trained to incorporate is very foundationally different. It's a very different approach. It's a very different way of thinking. Now, it doesn't mean that an integrative or functional doctor can't acquire those philosophies, right? They can't. However, it is very difficult because they already come with their own frame of mind, and it's very difficult sometimes for people to shift from one way of thinking, a paradigm, to a different paradigm, right? It means that you have to leave what was behind. It's not fully true. So in this world, we consistently see this fragmentation of the healthcare system. It is completely just fragmented. There's many things that are wrong with it. That's not what this episode is about. But unfortunately, a lot of healthcare is driven by it's symptom focus driven. And many patients are searching for something more comprehensive, something that's a lot more personalized. And they want practitioners, doctors that they can understand the root cause. They can at least think outside the box and start researching, investigating where could this have come from, right? And so not just throwing a medication to suppress it, but actually to do something about it to resolve the issue. So I want to talk about what is naturopathic medicine. In this episode, we're going to explore various things. We're going to talk about the naturopathic medical doctor. Some call themselves NMD. Some are just NDs, naturopathic doctor, naturopathic physician, same thing. The term naturopathic, naturopathy are exclusive to those doctors that were originally what we call the vitalists, the nature curists, that, were pioneering this and continuing this field of naturopathy. And so understand that there are accredited naturopathic medical schools across the country, and to be considered a naturopathic medical doctor or naturopathic doctor or physician, that person had to have attended one of those accredited naturopathic medical schools to get the full gamut, right? The philosophy, the training, everything that's encompassing that. So we're going to talk about that. We're going to talk about naturopathic medical training. What does it consist of? I think a lot of people think we're just playing with a little bit of herbs and some natural things, and they don't really understand the in-depth training that naturopathic doctors receive and how it differs from conventional medical training. We're going to introduce a little bit of the six foundational principles of naturopathic medicine. We'll do an individual episode for that in the future. And then also the naturopathic therapeutic order and why it matters, why it's so unique to naturopathic medicine. And so we'll talk about, different approaches that we take to treating chronic conditions, and like I said, our philosophy. So we're going to go ahead and get started. So what is a naturopathic medical doctor? Like I say, these doctors are clinically trained through not just being healthcare practitioners. We're educated in both all the conventional medical sciences and evidence-informed natural therapeutics. Now, I will tell you that a lot of the natural therapeutics, they have such a long history ancestrally, that people have been using these natural herbs or homeopathic remedies or any therapeutic that's ancient, right, through many, many, many years. And that also, the consistency of that herb, for example, being used consistently through many, many years is evidence that the remedy works. Now, I know some people are very science-based minded. They want the proof. They wanted to do it in the labs, and that's great. Some people need that, and you can go and entertain yourself with that. But for some of us, we have seen the evidence in our clinics through time historically, culturally. We've seen those same herbs that are consistently effective at treating certain things, and the dosing and for every individual varies, but we know the evidence through the clinical approach that we have. So I want to talk about how licensed naturopathic doctors, like I said, we are trained, we have to have an undergraduate pre-medical education or have certain science course requisites before entering naturopathic medical school. So you do have to have a 4-year degree. Our programs are 4 years. The graduate program, it's a doctorate program in naturopathic medicine. There are accredited schools here in the country, and they are 4-year or more graduate level training. We are trained in all the biomedical sciences that include anatomy, physiology, pathology, pharmacology, biochemistry, all the clinical diagnosis. We have clinical rotations and patient care training that we do while we're in the program. And then naturopathic medical doctors have our own national board examinations. We have 2 parts, one that has to be completed after 2 years of being in medical school. It's all the biomedical sciences. And then after graduating, there's a very, very extensive 3-day examination of various areas of our medicine, both conventional and natural, that we need to you take and pass. And if you don't pass them, you have to take them again. And they're pricey exams, just like conventional medical programs. But once the graduate finishes these board examinations, then they can go on and get their license and start practicing. In licensed states, they are licensed naturopathic physicians. And in some states that are not licensed, they can still practice naturopathic medicine, but not to its full extent and scope, because they cannot practice as a doctor. They have to practice more as someone who's providing recommendations and guidance. So let me tell you, with a naturopathic physician, all the areas that we're trained, I want to talk about those, because let's talk about first the conventional medical part. All the things that conventional medical doctors are learning, this is what we're learning. We learn emergency medicine. We learn how to implement and create emergency medicine tools in our office in case of those emergencies, acute care, trauma. We do learn minor surgery. So many people are surprised to know that naturopathic doctors, we can do minor surgery, and some of us do, and some of us focus more on that, and some of us do a little bit of it. Infectious disease management, any life-saving interventions. So we are trained, we're trauma-informed, trained, and we also know how to, like I said, treat people if there's psychological issues that need intervention. Pharmaceutical management, that is something that many people are surprised, but we need to understand the pharmaceutical drugs, because sometimes we are taking patients off of those drugs, so we need to know how to do that. Sometimes there are drug interactions with other natural therapeutics, and so it's very important that as we, provide a natural substance, whether it's a herb or a vitamin, a nutrient, that we understand what are the interactions, contraindications, so we can treat people safely. We do prescribe them medications as well. That was not originally a nature cure treatment that we would use, is pharmaceutical drugs, but sometimes they are needed, and we know how to use them temporarily to get people where they need to be while they make the lifestyle choices. But there's a lot of anatomy and physiology that, as naturopathic doctors, we have to learn, and all doctors do. And I'll tell you this, if a doctor, a practitioner, anybody who's working in healthcare understands the anatomy and the physiology, then you can help a person to reverse disease. Because if you understand the physiology, you understand the anatomy, you understand what's going on. And so that, keep in mind, is very key to understanding the root cause of disease. If someone is not looking at the physiology, anatomy, whether it's a structural or something physiological, you're not going to be able to help the person cure. Biochemistry, microbiology, gynecology, obstetrics, urology, endocrinology, oncology, neurology, pediatrics, hematology, gastroenterology, cardiology, all the ologies. Yes, that's right. Naturopathic medical doctors, we learn all that. Now, here's the difference. When we learn these conditions, when we go through these areas of medicine, we're learning, what is the conventional way of treating those conditions? Well, first of all, let me step back. First of all, it's how do we assess those systems? What are the tests and imaging? What are the different conditions that, for example, would present under endocrinology? What are the different organ systems and the different symptoms associated with each? And then what are the tests, right? What are the lab tests that we would do, or imaging for various conditions to screen? Then we have to learn what are the conventional approaches to treating, say, the thyroid. What is the conventional way that a doctor would treat the thyroid? We know they do a lot of levothyroxine, right? And then we talk about all the other natural therapeutics, which are many categories. What are the botanical herbs that would support someone for hypothyroidism or hyperthyroidism or an autoimmune thyroid issue? What are the homeopathic remedies that we could use for that? What is the Chinese herbs that we can use to support that system? What are the acupuncture points that we could use to tonify those conditions? What's the nutritional plan for someone with Hashimoto's versus Graves' disease versus some other conditions? What are the physical therapies that we can use to also support the systems, whether we're using hydrotherapy or mind-body techniques, right? Addressing the mental health aspect. What are the things that we're going to use in all of those categories to support this condition, this really the person. And so we're not looking just at the condition, but we're looking at the person in totality. And we're going to talk about that. But these are the conventional categories that all medical doctors have to do. And in addition to that, naturopathic doctors, we are extensively understanding the mind-body component. So we're learning about mind-body medicine as well, into incorporating that. Like I said, the naturopathic parts that we're trained in, which is a lot: clinical nutrition, botanical medicine, homeopathic medicine. We learn about IV infusions, whether it's IV nutrients or other IV therapeutics, acupuncture, which can consist of, acupuncture itself, cupping, Eastern herbs. We do a lot of lifestyle medicine and physical medicine. We do a lot of physical medicine. We do adjustments or other physical therapeutics. We study environmental medicine, which environmental medicine is about looking at what are the environmental factors that could be affecting the person, chemicals, heavy metals, molds, all those toxins that could be building up in the person and causing disease. So, and then how to treat it, right? There's ways to treat it naturally. We learn various counseling techniques. This is very, very unique to naturopathic doctors, because I don't think that conventional doctors learn counseling techniques, how to listen, how to ask the right questions, right? We learn mind-body techniques to help, like EMDR, EFT, and holistic counseling. We are known to be very well known in working with hormone balancing. I've talked to OBGYNs, and I've heard that they get about 4 hours of training in hormone therapies in their education, which is a lot less. I mean, we get a lot of this kind of training in the program, and of course, throughout the program, and we implemented what are the right hormones to check based on the symptoms that people present, what are the tests, right, and what are the therapies, natural and also bioidentical hormone-wise. A lot of nutritional support, hydrotherapy. We learn extensively on laboratory interpretations, which tests to do, how to interpret them, what are optimal ranges. Not just, for us, it's not just okay to be within the normal range. You could be on the lower end of normal and feel bad, and that's why. It's your doctor saying, no, the labs are normal, and you take that same lab to a naturopathic doctor and they're saying you're not optimal. This is why you feel like that. We're not going to wait till those labs are out of normal. We're going to do what we as naturopathic doctors love to do, which is preventative medicine. How can we prevent you to not being iron deficient or hormone deficient? What can we do to put you in optimal ranges so that you do feel better? So we do it all, guys. Family medicine, men and women's health, we do a lot. And that is to say that in a 4-year program, for a student to do all that in a 4-year program, it's very, very demanding and very rigorous. You cannot compare this kind of a program to a conventional medical program. In my opinion, I would have found the conventional medical program easier in terms of time and even learning the material, because there's less to learn. The difficult part for me would have been working in a different paradigm that I don't believe in support, right? That is not just about throwing a medication or supplement, but it's about finding the root cause to disease. So these are, are you hearing how much a naturopathic medical doctor knows? We know a lot. We're trained a lot, both in our education, and all of these things get implemented into the lab. So a lot of this is learned from year 1 through 4. And then the last 2 years of the program, we are doing clinical rotations. And let me just share some numbers. The number of clinic hours and course hours, credit hours is 390 total credit hours that students are doing at the end of their 4 years there. The number of contact hours is 4,410 hours that that student, that, a graduate will have accomplished. And let me tell you, I know I can speak for myself, and I know a lot of my colleagues and many students right now in the naturopathic schools are also doing. We don't just do the hours that we're required to take. We go above and beyond. I know if I could get a rotation doing pediatrics with a clinic outside of the school, I'm going to go for that. So these schools have community clinics. They tend to have a clinic within the school, very nice clinics that patients can treat people there. But then there's community clinics that you get a wide variety of people, diversity coming there. But we also get to do rotations with other naturopathic doctors or conventional doctors. Some students have done rotations in emergency rooms in the hospitals. And so we can create those opportunities to go in and shadow doctors and work and observe them and learn more. And so many of us do. I know I did extensive training outside of the school hours, which extended beyond the 4,000 hours of training in pediatrics and women's health, and also a lot of in autoimmune, like endocrine issues, neurological issues, because those were the things that I really wanted to ensure to understand. So, what naturopaths are really, really good at, we're good in a lot of things, as you can see. I'm a little biased here, but what I see that we're really good at is treating chronic conditions. I tell my patients, if you're in an accident, you're having a stroke, there's an emergency need, you need to go to the hospital, not to me, right? That's what conventional medicines really excel in, is treating those high risk, those interventions, surgery, those conditions that are emergency based, that you need to go to the hospital. But many patients that we see now, most Americans, we're seeing is a lot of chronic fatigue. And chronic fatigue is an umbrella for, it could mean a lot of different things, right? Autoimmune diseases is something that we see a lot that is poorly managed, unfortunately, by conventional doctors. And so when they come see a naturopathic doctor, we're taking a whole different approach to that. Hormone dysfunction, digestive, any digestive disorder, anything that's inflammation, mental health, anxiety, depression. I've even seen people who have, bipolar conditions, that they're ADHD, those sort of things. So any long-term chronic illness, metabolic diseases, naturopaths are really good at treating those conditions. And these conditions are oftentimes, they are multifactorial. So a naturopathic doctor is going to really we do lifestyle medicine. We're looking at everything that person is doing in their life to assess what could be contributing to the disease state. We're looking at stress and sleep and nutrition. We're looking at environmental exposures, trauma, inflammation, of course, gut health, and is huge in all of this. And so these are some of the things that, naturopathic doctors we do very well in those things, because oftentimes patients, they have gone to every doctor and every specialist, and then they come to us as the last source. And I say that it should be in reverse. People should seek naturopathic care first as your first source to go and get help. And then let the naturopath refer you to the cardiologist, the endocrinologist, and so forth to fully assess and see what's going on. And let that naturopathic physician be the advocate, be the one who's the main doctor that's overseeing all of these conditions, right? And so naturopathic physicians are going to ask, what are the systems that are dysfunctional? After we evaluate everything, what are the systems that are dysfunctional? What are the root drivers? So where could be the main causes coming from? What are obstacles to preventing healing? Which is a lot more, like I said, this is a philosophy. We got to look at the obstacles of where the body is not able to heal. We're not looking and we're not focused on the disease. See, we don't focus on the problem. We look for the solution. And so if you're focused on the problem, then you're not going to find the solution. And so what is preventing this person from healing, from curing? That is a whole different mind shift that you have to make, because you're focused on identifying those areas so that you can remove those obstacles to cure. What conditions allow this illness to develop? Are there certain conditions this person has been in that have allowed this illness to continue? Is it the poor diet, too many carbs, too much sugar, that the person has been in that condition? Maybe they're stressed, maybe they have low resources to get food, and so they're just eating whatever they can, and so that might be what contributed to illness to develop, right? And then how do we restore the body's own natural resilience and ability to heal? So I'm not even going to talk about how to differentiate ourselves from other practitioners, because like I said, we are driven more on a root cause investigation. We have a therapeutic order that we follow. And so when you work with a person who calls themselves a functional or integrative doctor, they are still taking concepts of conventional medicine, which is do the labs and treat what you find out of balance. When a naturopathic doctor approaches this, even just in the questions that we ask in our assessment, we're really investigating and looking down at the lifestyle. We're trying to understand the person, not to judge them, not to criticize them, but to help them. And so we'll ask questions. For example, tell me what a typical meal for breakfast looks like for you. What are you eating for lunch and dinner? Are you having breakfast? Are you having lunch? What does that look like? What time are you eating? How much are you eating of these foods? Are you eating anything in between? What are you drinking? What is the environment that you're in when you're eating? Are you eating in your car, driving to work? What are those? Explain to me that. And the person needs to feel safe and needs to have time to share that with you and not feel judged. And so sometimes we'll do diet diaries where we ask them for a week, just track everything you're eating, no judgment. We just want to get an idea where you're at. Because if we know where they're at, then we can start making small changes and modifications to their diet without overwhelming them. Now, everyone's different. Some people are ready to implement 100% of what you have to offer, and that's great, but that's not the majority of people. And if we overwhelm our patients with too much, too soon, they'll stop. They won't even try. So we want to meet them where they're at and work with them step by step to getting them to where they need to be. Then we're talking about sleep. What time do you go to bed? Do you have a hard time falling asleep? Do you wake up a lot during the night? How many hours do you think you're sleeping? Do you wake up? What time do you wake up? Do you wake up feeling rested, or do you still feel tired? All of that is information that helps us to think of which labs do I need to test, or what could be going on. Because the reality is the original naturopathic doctor, right? The nature curists, the vitalists, they didn't have access to tests. We're talking about a long time ago, many years ago. So they were not doing tests. But the patterns of the lifestyle of the person, their symptoms, gives us enough information that we could technically treat the person. But because we live in a modern time, we know that people, when they see a value on labs, right, they make a concrete connection of what those values are and what they represent. Because when we review lab values with patients, we are explaining what is it they're looking at. What does this mean? Because as naturopathic doctors, we understand that if our patients also understand those values, those same terms that we know what they mean to us, they understand what's really happening. They're more likely to implement the changes that we ask them to. So education is a huge part to what a naturopathic doctor does. And we're going to talk about that more in the future. So we're asking these questions, right, to get information, to find out about the person who's sitting before us. And here's the thing that distinguishes us. as naturopathic doctors from any other practitioner, and that is that we provide a customized treatment plan for each person. You cannot treat every person the same. You just can't. So there is no cookie cutter approach to this form of medicine, which makes it so difficult for some practitioners because, and in business too, because sometimes you hire someone to help you in your clinic as a naturopathic doctor, and they want to streamline the process. They want to find a cookie cutter approach to each patient, and it doesn't work that way. No two patients are the same. So you can have two people coming in to be treated for type 2 diabetes, and they're both going to be approached differently because they have two different types of lifestyles and different things going on in their life, in their history, in the present time, in their physical body, mentally, emotionally, they're different. And so, yes, we might use some of the similar herbs, but even the dosing might vary. And so the treatment plan is still very customized to that individual. No two people are treated the same in naturopathic medicine. And that's how I can tell you for a fact that integrative functional medicine doesn't work that way. They usually still have a protocol. Diabetes, everyone with diabetes type 2 gets the same treatment, and we do these same things over and over. And so we can be missing out on opportunities on unique areas that person might need more support for healing. So in the next episode, I want to talk about more in depth on the philosophy of what sets a naturopathic apart, because I'll do just a quick intro here before I wrap up. And that is the philosophy of naturopathic medicine is grounded on these 6 foundational principles. And those principles are, number 1, the healing power of nature. 2, identify and treat the root cause. 3, first do no harm. 4, doctor as teacher. 5, treat the whole person. And 6 is prevention. So, like I said, bottom line, what really sets us apart is going to be our philosophies and our approaches to care. So if you have worked with a naturopathic doctor and they haven't done this, it's probably because they're operating under somewhat of a conventional medical system, or what they call integrative or functional medicine, which you're still using, you're still treating symptoms, but you're using natural things to treat the symptom, never looking deeper to look at the root cause. Because when someone heals, right, when there's a true cure and someone heals, you no longer need the therapy. You no longer need the medication. You will no longer need the herb. You will no longer need the thing that you're taking to treat it. Now, if you keep taking all these supplements over and over and you feel better, great. But if you stop them, are those symptoms going to revert back? And there's a time and place. Chronic disease is very, it's not cookie cutter. Everyone's journey is a little bit different. I hope that this has helped you to understand what is the difference between a naturopathic doctor and any other practitioner, that we really do have a different principles, different philosophies and theories that we approach care. So, hey, join us in the next episode because I'm going to talk more in depth about those 6 principles of naturopathic medicine and what does that have to do with you. So until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raíces, visit our website at raicesndmedcenter.com. Until next time, be blessed.